Post-traumatic stress disorder in veterans is more than flashbacks. It's a complex condition with deep roots. While we hear that 7% of veterans get PTSD, for those in a war zone, the rate skyrockets to as high as 80%. This huge gap between the common statistic and reality for combat veterans shows how much of the story we're missing. A major part of the problem is that the most common signs are not what people expect. They are subtle and hidden. Now, we will uncover these overlooked symptoms, explain the mechanisms behind them, and show effective paths to healing. So, what are these signs that so often go unnoticed by veterans and their families? Let's look beyond the stereotypes. One of the hardest symptoms for loved ones to grasp is emotional withdrawal. This isn't a lack of caring, it's a protective shield. This numbness can lead to anhedonia, the inability to feel joy. Activities and people that once brought happiness feel empty. PTSD also directly impacts cognitive function. This appears as trouble with short-term memory, forgetting appointments, or losing things. Then there's the physical hypervigilance. An exaggerated startle response means the nervous system is stuck in a high-alert state. Numbing, memory loss, constant alertness. These aren't character flaws. They are symptoms of a system altered by trauma. But why? The key to understanding many symptoms is the hyper-aware state. After trauma, the brain's threat detection system fails to turn off. This is not a conscious choice. The person constantly scans for danger, even at home. This state is mentally and physically exhausting. This explains the startle response. When your system is already on high alert, a door slamming is perceived as a major threat, triggering a huge reaction. Living in this state makes normal life incredibly difficult. The brain prioritizes survival over simple tasks or social interactions. This constant fight-or-flight state doesn't just affect the mind. It takes a severe, measurable toll on the physical body. But how? Let's look at the tangible, long-term consequences that ripple out from these core symptoms. This is where the struggle becomes a crisis. The emotional weight of untreated PTSD often leads to other serious conditions. To cope, many turn to substances. In fact, the connection is incredibly strong. More than half of all veterans with PTSD also have a co-occurring disorder, like anxiety or depression. And this isn't something that just fades. Veterans can have symptoms 50 years after service, and for some, the symptoms actually increase with age. Think back to the hyper-aware state. Living like that for decades erodes relationships, pushes family away, and leads to profound isolation. On top of all this, getting a clear diagnosis can be a major challenge in itself. The symptoms can be mistaken for other conditions. A prime example is the overlap with mild traumatic brain injury. Memory problems and irritability are common to both, making it hard for doctors to distinguish. This confusion can lead to incorrect or incomplete treatment plans. A veteran might be treated for one condition, while the other goes unaddressed. Now, let's connect all these pieces. We have seen the hidden symptoms, the mechanism of hyperawareness, and the long-term consequences. We asked how psychological stress translates to physical illness. The answer: that constant hyperaware state puts immense strain on the cardiovascular system. The same mechanism causing the startle response also contributes to hypertension and high cholesterol. The mental trauma physically damages the heart. So, trauma rewires the nervous system into hypervigilance, which manifests as hidden symptoms, leading to comorbidities and physical damage. Understanding this devastating chain of events is critical, but the story doesn't end there. There is hope. Effective treatments exist. The gold standard for PTSD treatment is trauma-focused psychotherapy. It's a targeted approach with a trained professional to process the trauma. Two highly effective forms are cognitive processing therapy, which challenges unhelpful thoughts, and prolonged exposure therapy for confronting memories. Another powerful tool is EMDR, or eye movement desensitization and reprocessing, which uses back-and-forth movements to help the brain make sense of trauma. Alongside therapy, specific medications can be prescribed. They are not a cure, but they can help manage symptoms, making therapy more effective. The path is not easy, but through therapies like CPT, PE, and EMDR, it is possible to retrain the brain's threat response and move from surviving to living. If you or a veteran you know is struggling, You are not alone, and you are not broken. Reaching out is a sign of strength and the first step to reclaiming your life.